this leads in, we kind of answered this, but the second question was, do you offer radio frequency at your clinic? Which we do. Endymed, it's great. And the plasma pen is Accor, which we love. And radio frequency, how does it actually work? And is it painful? Because I'm not that brave. In fact, I could have written that.
Have you had any?
Yeah, I've had I can't say I've had everything, but I think I've had most things. I've had some radio frequency. I had a neck one. I have.
Yeah, but you've had one of everything.
Yeah, I've had a little bit of stuff. Yeah, I've not had a course of anything. So if I'm still looking saggy and horrible, that's why.
I'm just gonna have to skin shame you because you don't use your products properly.
Yeah, exactly, Jan.
You know that Abaji 360. I think you
Don't
in fact I know.
Forgot it.
Yeah, so I think it was like February or March last year, and it should have lasted me 6 months, and I've still got some. In fact, I think Bex used up the rest of my retinol just recently.
You would be a terrible patient.
I would be a terrible. We know this.
He's rubbish.
You'd be so frustrated.
I know.
I'm that person who'll go in. I'll say, yeah, I want it all. I'll buy the set of New Derm, whatever it is. I'm going to spend £1,000 on products, and it'll sit on my shelf, failing to get my skin better.
Oh, you need to keep using it.
Thank you. So,
so Endymed, Endymed is obviously our radio frequency device. It is amazing. It's got so many different things that it does, and you can use it for pretty much anything. You can use it for eyes, you can use it for the face, you can use it for the body. It's really good for the chin and jawline. For trying to reduce those little kind of bits of pockets of fat that can get here and here. So it does so many different things. But the way that it works is essentially radio frequency is delivered into the skin. It meets resistance in the skin, and then that energy turns to heat, and the heat contracts the collagen already in the skin. So that's why you get that nice kind of tight feeling. Everyone always says afterwards, oh, it looks really good for at least a day or two. So it's a kind of temporary thing. But it's just because it's just the way that the treatment works. So it contracts that collagen that's already there, but then through the inflammation processes in the skin, it stimulates your fibroblasts to then produce more collagen. So that collagen then takes a period of time for it to mature and to remodel. And then about 3 months after you've had your last treatment is when you get your kind of final results. But it is the most lovely treatment to have. It feels I always liken it to a hot stone massage. So we apply gel onto wherever we're treating. Most of the time it's the lower face because people come in and they say, I want to do this. So it tends to be from the cheeks down to here that we treat most of the time with our patients. You apply a layer of ultrasound gel, and then you just take the handpiece and then you take it over the skin in circular motions, and it builds up heat. Gradually, you want to try and get the skin to between 41 and 43 degrees, which sounds really hot, but actually it's really comfortable. And we check the temperature really regularly with an infrared thermometer, and just to make sure that you're at the right point, because when you're between that 41 and 43 degrees, that's when you're going to get that response in the collagen. We don't want it to be less than that, because obviously we don't want to give you a substandard treatment. We don't want it to be more than that because we don't want to risk causing any burns to the skin. So yeah, we check it regularly, but it's so comfortable. The only thing that can sometimes happen is you can get a little hot spot, and I always say to my patients, just please let me know if you get that hot spot. Don't lie there and think, oh, I must grin and bear it. It's not that kind of treatment at all. Commonly over the kind of bonier areas, so the cheekbones and the jawline, it can sometimes heat up a little bit because you've got less tissue there. And if you get a hot spot, you just basically move on, stay away from it for 10 seconds or so, let it cool down, come back over it, and then you can continue the treatment on. But yeah, it's such a nice treatment to have. They're weekly treatments, so we get to know our patients really, really well, which is nice.
How long do they last?
The appointments, so generally about half an hour. Half an hour to about 45 minutes. It depends on people, whether people are having just one area or two. Quite often we have people that come in for the lower face, but they also want to have the neck, because who wants to look young ear, but then have an older neck. So we quite often do 2 areas in one go, or we'll do the cheeks and the eyes, or we'll do the cheeks and the kind of jawline, really focus on the jawline if they've got a little bit of excess fat there. And so generally it's weekly treatments.
For a month or so?
You do the first 4 a week apart, and then the last couple 2 weeks apart. So it kind of takes 8 weeks to finish the program. So we get to know people really well. It's really nice. And yeah, it's a nice treatment because people aren't expecting it to be painful. They know it's nice and comfortable. We tend to just have a chat. The half hour goes really quick, and there's no downtime. And that's the wonderful thing about Endymed, is that you can literally have it in your lunch break. You could go back to work and no one would know that you had anything done. And that's why it's so popular with so many people, even celebrities are having Endymed done, because it's there's no downtime, there's no obvious signs that you've had any treatment done, but as you age, your collagen is always in decline, for pretty much from about the age of 18 or something really sad like that. But once you hit 30, it starts to decline even quicker. So what this is doing is it's basically causing, as that declines, it's causing that collagen spike in the skin. So you are going to continue to age, but it's just going to mean that your skin's going to be in better condition. So you're going to have more collagen, more elastin, the skin's going to be healthier. So yeah, it's a really, really nice treatment to do.
So that explains, I think, something, because there's always this kind of double thinking that they are, it gives you results and it gives kind of, permanent changes, permanent results, but we ask patients to consider topping up every now and again. You think, well, why are we topping up if it's permanent? And I think that's, you just explained it really. You're in constant decline, so we need to keep fighting the tide, I guess. Yeah,
definitely. The results can easily last 12 to 18 months after an Endymed, but like you say, what's the point in doing all that hard work and getting those results and then not maintaining it? Because then you're going to have to do another full course again. Whereas if you just do the odd one every now and again, every 4 to 6 months, most people probably do it every 6 months, so like a couple of treatments a year. And it just keeps it nice and regular, keeps that collagen stimulated, keeps their skin in good condition. And then there's also other things that
sorry, just so a single treatment once or twice a year, so they don't go through the whole 6 to 8 weeks or whatever.
If there's a big gap and we think, well, actually you've not had treatment for maybe 3 years, 2 or 3 years, then it's probably worth doing another course of treatment. But if you can maintain it, like I said, 4 to 6 monthly with just one session, then that's absolutely fine to try and maintain those results.
What a nice way to spend 30 or 45 minutes, for a while every now and then.
Okay, I don't have enough time.
Are some of them not more painful than others? Because I don't deliver these treatments, as you know, so I was happily telling patients, oh, it'll be fine. It's like a hot stone massage, and then it's the Endymed, isn't it, that's a bit more sore.
So you've got different hand pieces that you can use on the Endymed. You've got the Titan hand piece, which is the one that it penetrates between sort of 3 and 4 millimeters into the skin. It's the one that's comfortable, so that's the one we were just talking about. Then you've got the V-shaper, which is the one that we use on the jawline, and now it penetrates deeper. You wouldn't use that on the face because it actually can penetrate to the fat layer, and the last thing you want to do on your face is get rid of fat. You want to. I know some people think that they do, but they really don't. They don't want to look at pads because
it's not good.
So, so when we're treating the jawline and the chin, people will quite happily get rid of fat in this bit and this bit here. So we use the mini shaper on that because it does penetrate a bit deeper, but still it's fairly comfortable. And you don't try to get quite so hot because it is penetrating that little bit deeper when you use that head, sorry. But then you have the FSR, which is the fractional skin resurfacing, and that's the one that's a little bit more comfortable. So when we talk about Endymed, the Endymed is using the FSR, and you can use the FSR anywhere. It ablates the surface of the skin. It does heat up the dermal collagen as well, but it does, in a very similar way to sort of as we're talking about plasma pen, but it basically, every time you do a shot with the FSR, it puts 112 microscopic little channels into the skin. So obviously the build-up of heat, it can feel like a little electric shock. So we always numb we always numb before any FSR treatments, because local anaesthetic on first of all, and that will make it a little bit more comfortable for the treatment. But it can be a little bit stingy. It's not the nicest. But when you do it around the eyes, it's very quick. That's the good thing about it. It doesn't take long at all. It depends, obviously, if you're doing a bigger area, it will take longer. But
can I ask? So this is totally putting you on the spot. You may not know the answer to this. It's only just occurred to me. So sorry, but you know, there were some products that we trialed a while ago, and I'm not going to say the name, but we didn't find them that helpful, and we discontinued them. But there were the things that sort of prickled microchannels into you, and then you'd apply hyaluronic acid kind of serum to them, and that's meant to help penetrate into the skin better. Could you therefore combine, do you think, FSR with a topical HA to try to do something similar?
Yeah, you could. Yeah, you could do. I don't
Copyright, Eterno 360.
Yeah, I don't see why not. The only thing is, whenever you do treatments like that, is you have to be careful what you're applying isn't going to cause any more sensitivity to the skin. So when we do treatments like skin pen, which is the microneedling, we cannot put anything else on the skin after, because obviously you've put the tiny little holes into the skin. You can get sort of sensitivity reactions in the skin if you start just putting anything else on afterwards, because you do have sort of access much deeper into the skin then. So yeah, we'd have to look into that one.
Yeah, well, maybe think about it, but you know,
we can try it on you.
You can try it on me. It's fine. Okay, cool. That's brilliant. I've learned an absolute ton there about Endymed.